Welcome back to sqadia.com. We are talking about the hip joint, and to understand the hip joint, it is very important to know about the bones which actually make up any joint. And in this lecture, we are also going to talk about the specific bones and the structures which are actually responsible for making the hip joint, because that is the integral information that we need. So in that sense, we're going to take a look at the nominate bones, which is made up of ilium, ischium and pubis, and also the femur, the proximal part of the femur, which is responsible for the formation of the hip joint. So let's start off with the bony landmarks, and first of all talking about the nominate bones. So the hip joint is made up of two components. One is the hip bone and one is the femur. And the hip bone, also known as os coxa, also known as innominate bone, and also known as pelvic bone or coxal bone. Now, it is not a single bone. In fact, it is made up of three different bones, which are known as ilium, ischium, and pubis. And these bones fuse together as one by the adulthood, which is known as the os coxa, or the innominate bone, or the pelvic bone, or the hip bone, as we already mentioned. And as you can already see in this picture, it is an irregular shaped bone, which is actually composed of three different bones. Now, this superior part is the ilium, the one on the anterior aspect is the pubis, and the one on the posterior aspect is the ischium. And the specific structure at where the proximal femur or the femoral head articulate with the hip bone, which is known as the acetabulum, is the area where these three bones meet each other and they contribute equally to form the acetabulum. And this is the area where the femoral head articulates, and this is known as the acetabulum. And you can see that acetabulum has a portion from the ilium as well as the ischium as well as the pubis. Now let's take a look at these three bones which compose the overall innominate bone one by one, starting off with the ilium, which is located superiorly, and it is a fan-shaped bone, and it makes up the superior aspect of the innominate bone, as you can see in this picture, as well in the lateral view as well as the medial view. Now, talking about the significant landmarks of the ilium, first of all, we have the iliac fossa. Now, where is the iliac fossa found? So, iliac fossa is on the medial aspect of the ilium or the innominate bones, and this fossa, this big depression, is actually the iliac fossa. And it is large, smooth, concave area on the internal or the medial aspect of the iliac bone or the iliac portion of the innominate bones. And another significance of the iliac fossa is that it serves as the attachment site for the iliopsoas muscles. Iliopsoas, which is also known as iliacus and psoas major, if we talk about them separately, and they are the prime flexors of the hip joint as well. Another very important structure is the iliac crest. It is perhaps the most easily identified structure and even the most easily palpable structure in the ilium. And this is the iliac crest. We can see this iliac crest on both the medial and the lateral view, and it is the bony part that your hands rest on when you put your hands on your hips when we are standing. And the anterior and the posterior border of this iliac crest end up as two structures known as the anterior superior iliac spine on the anterior aspect and the posterior superior iliac spine on the posterior aspect. So this is the anterior superior iliac spine. Similarly here, this is the anterior superior iliac spine. This is the posterior superior iliac spine. Similarly here, this is the posterior superior iliac spine, and in between the anterior and posterior superior iliac spine we have this iliac crest here as well as here. So talking about the anterior and posterior superior iliac spines, we also have the anterior inferior iliac spine, which is just inferior to the anterior superior iliac spine. Similarly, we also have an posterior inferior iliac spine, which is inferior to the posterior superior iliac spine. You can also look at them on the medial aspect. This is the anterior inferior iliac spine, and this is the posterior inferior iliac spine. Now, as you already mentioned, anterior superior iliac spine is the projection on the anterior end or the anterior border of the iliac crest, and it is important because muscles including the tensor fascia lata, sartorius, as well as the inguinal ligament, they attach on the anterior superior iliac spine, which is the anterior point of termination of the iliac crest. Similarly, if we talk about the anterior inferior iliac spine, this projection is just inferior to ASIS or the anterior superior iliac spine, and the significance is that the rectus femoris, which is the part of the quadriceps femoris, which is the primary knee extensor as well as the secondary hip flexor. So this muscle attaches at the anterior inferior iliac spine. Moreover, talking about the posterior superior iliac spine, it is the posterior projection on the iliac crest or the termination of the iliac crest. And talking about the posterior inferior iliac spine, it is located posteriorly just below the PSIS. And as we already mentioned that the rectus femoris has its attachment site or the anterior inferior iliac spine. We can see this is the anterior inferior iliac spine, and this here is the attachment site for the rectus femoris. Now, the second bone in the innominate bone or the os coxa that we already mentioned was the ischium, and it is located posteriorly, and here you can see in this figure. So this here is the ischium. So this is the lateral view, and here this is the ischium, and this is the medial view. So in ischium we have a posterior inferior portion of the hip bone, and we usually sit on our ischium, and the specific part of the ischium that we sit upon is known as ischial tuberosity, which is located here. Now it has different bony landmarks and structures. The ischium, one of them is the body. So it makes up about 2/5 of the acetabulum, and this here is the body of the ischium. Similarly, if we look at the medial view, this is the body of the ischium. The second structure is the ramus. Ramus is located inferiorly and anteriorly in the ischium, and it extends medially from the body to connect with the inferior ramus of the pubis. So the ramus of the ischium communicates with the inferior ramus of the pubis. Pubis, on the other hand, has two rami, which is the superior ramus and inferior ramus, and collectively they are known as rami. And the muscles, including the adductor magnus, which is a part of the hamstring, as well as the adductor group of muscles, the obturator externus and the obturator internus muscles also attach here. So it serves an attachment site for 3 different muscles. Moreover, we also have the ischial tuberosity. The significance of which I already told you is that we sit on our ischial tuberosity, so it is the weight-bearing bone in our sitting position. Moreover, it also provides an attachment site for the hamstring muscles, including the semitendinosus, semimembranosus, biceps femoris, as well as the adductor magnus muscle, which also is a part or considered as a part of the hamstring because it also acts as a knee flexor. Moreover, it also has a structure which is known as the spine of the ischium or ischial spine. Now this here is the ischial spine. Some people confuse it with the posterior inferior iliac spine. So this is the posterior inferior iliac spine, which is just below the posterior superior iliac spine, but ischial spine is pretty much down as compared to the posterior inferior iliac spine because it is the structure which differentiates between the greater sciatic notch and lesser sciatic notch. So posterior inferior iliac spine is above the greater sciatic notch, and ischial spine is below the greater sciatic notch. So it is located on the posterior portion of the body between the greater and lesser sciatic notch, and it provides attachment for the sacrospinous ligament. Lastly, the third part of the innominate bone is the pubis, which is located antero-inferiorly, and the pubis forms the anterior and inferior portion of the hip. So it, once again, just like the ischium, it also has a body and externally forms about 1/5 of the acetabulum and internally provides attachment for the obturator internus muscle. Moreover, as they already mentioned, that pubis has two rami, one is the superior ramus and one is the inferior ramus. So here we have the superior ramus, and it lies superior between the acetabulum and the body and provides attachment for a muscle which is known as pectineus. Similarly, we also have an inferior ramus, and it lies posterior, inferior and lateral to the body of the pubis, and it provides attachment site for adductor magnus, adductor brevis and gracilis muscles. Moreover, the two pubic bones, they join each other by a structure which is known as symphysis pubis, which has also a fibrocartilaginous disc in between, and that is known as joint which is known as symphysis pubis, and that is the structure which is connecting the two innominate bones anteriorly. Posteriorly, they are connected with the sacrum, making the sacroiliac joint at the level of the ilium of the innominate bones. So symphysis pubis is a cartilaginous joint connecting the bodies of two pubic bones at the anterior midline, and we also have another structure which is known as the pubic tubercle, and it projects anteriorly on the superior ramus near symphysis pubis and provides attachment for the inguinal ligament. And if we want to look at this figure, here we can see that this is the superior ramus, and just beneath the superior ramus, this here is the pubic tubercle. Other landmarks which are very important include the acetabulum, because it is the concave bony partner of the two articulating surfaces, and it is a deep cup-shaped cavity that articulates with the femur, but it is smaller than the femoral head, so it needs the acetabular labrum to deepen the socket of the acetabulum to receive the femoral head, and made up of nearly equal portions of the ilium, ischium and pubis. Now obturator foramen is another structure. It is a large opening made up of the bodies of the rami and the ischium and pubis, and through which different blood vessels and nerves pass through. At the end, we have a structure which is known as greater sciatic notch, which is between the posterior inferior iliac spine and the ischial spine, and it is a large notch which is made into a foramen by the sacrospinous ligament. The very important and a very large nerve of the lower extremity known as the sciatic nerve, and the muscle which is the piriformis muscle, and there are different other structures as well pass through this greater sciatic notch, and thus it is of great functional anatomy significance. And if we look at this picture, so as I already mentioned, this is the posterior inferior iliac spine, and this is the ischial spine, and this is the area of the greater sciatic notch through which piriformis and the sciatic nerve pass through. And this here is the obturator foramen through which different other nerves and blood vessels also pass. It is also important to look at the proximal aspect of the femur, because it also participates as the convex bony partner in the ball and socket hip joint. And here we have the head, neck, greater trochanter and lesser trochanter. So talking about the head, it is a rounded portion covered with articular hyaline cartilage to ensure smooth movement with less friction, and it articulates with the acetabulum, which is a part of the innominate bone formed by the combination of ilium, ischium and pubis. And then there's the neck, which orients the head into a proper alignment, which is oriented superiorly, anteriorly, and medially to articulate properly with the acetabulum and to perform proper biomechanics. And it is the narrow portion located between the head and the trochanterus, connecting the head with the shaft of the femoral bone. So moreover, we also have the greater trochanter, which is actually a large projection, and this large projection is located laterally between the neck and the body of the, or the shaft of the femur, and it provides attachment sites for gluteus medius, gluteus minimus, and other deep rotator cuff muscles. So here we can see this is the greater trochanter, and here we can see that there is the attachment for obturator internus and gemini, and also for the gluteus medius. And here we have the lesser trochanter, for which is located medially and inferiorly, and here we have the attachment site for iliopsoas. We also have the attachment site for gluteus medius, which we can look in the next slide. So here the gluteus medius, and on the other aspect we have the gluteus minimus, and here we can see that once again iliopsoas is also there. So lesser trochanter, a smaller projection located medially and posteriorly, just distal to the greater trochanter, as I already mentioned, and it provides attachment for the iliopsoas muscle, and iliopsoas is a combination of the iliacus and psoas major. And on the neck, this line is also very important, because this is actually the boundary or the free edge of the joint capsule, which surrounds the whole joint. And here we have a small round depression, which is known as the fovea, and here the ligament of the head of the femur comes and attaches to the femur, which also has blood vessels for the contribution in the blood supply of the femoral head and the hip joint. So that was all about the bony structures that make up the hip joint, and stay tuned and watch other lectures in the series as well for a better understanding, and stay tuned to sqadia.com. Thank you very much.